As the governor mentioned, we are saddened to report the first death of an individual here in Illinois due to COVID-19. We had hoped that we would not join other states and countries in having to report such news, but of course we did anticipate it, as well as many additional cases that are yet to come. The individual, as was mentioned, is a Chicago resident in her 60s who had close contact with another COVID-19 case. And of course, as the governor has also mentioned, more than this just being our first case, this is someone's loved one, someone's child, someone's parent, a vital part of a community. And COVID-19 has ended that life. And we're very sorry, and we hope that everyone will lift their thoughts and prayers towards people who are directly affected by this situation. And unfortunately, we also have an outbreak of COVID-19 in a long-term care facility. The first resident was confirmed on Saturday, and a total of 18 residents have now tested positive in addition to the 4 staff. Residents are being isolated either in a separate wing of the facility or in the hospital, and staff that are positive are furloughed at home. This reinforces the need for all of us to do our part to reduce possible exposure in the community to those who go in and out of these facilities as they provide care to these residents. Let's recall that these residents are sitting in what is their home. It's the virus that is being brought into them, either by visitors or by staff. And that is why we have taken the aggressive measures to say that visitor restrictions have to be in place. That is why pre-shift assessments for all staff coming in have to be in place to make sure that staff who are coming in to care for these residents are not unwittingly harming the people they're charged to care for. Residents in nursing homes are, of course, our most vulnerable population, and we have to continue to do everything we can to protect them. Another step is to avoid all non-essential healthcare personnel from entering. At this current facility in DuPage, we have an IDPH team, a local health department team, CDC staff is on site, our UIC infectious disease consultant is on site. We have a robust team that is working tirelessly to ensure that we do our very best to protect all the residents in that facility. We're actively screening the residents, sometimes every 2 hours, looking for fever or respiratory symptoms, monitoring oxygen saturations. We're using all the information that we've garnered from talking to our counterparts in Washington. The governor has talked extensively to the governor of Washington. I've extensively talked to the state epidemiologist and the state health official in Washington. Through their guidance, they have been able to give us additional tips, additional suggestions on what we can do to really achieve the best possible outcome for all the patients in the facility. Statewide, 160 confirmed cases of COVID-19 in 15 counties across Illinois have been identified. The guidance is continually evolving based on the science available at the time, so we ask people to stay up to date on all of the latest information. You have heard me say it before, but it bears repeating. If you are sick, stay home if you have mild symptoms. If your symptoms get significantly worse and you have a complicating underlying medical condition, call your doctor and then discuss whether you need to seek medical care in person. With that advance call, that advance notice, appropriate arrangements can be made to reduce the risk of exposure to other people as you enter a healthcare facility. We want to protect our healthcare workers as they are going to be key in the fight and the struggle against COVID-19. I also wanted to clear up some confusion. I know that there are other coronaviruses out there and people may be familiar with them, and some people have tested positive for the coronavirus that comes on the respiratory virus panel. And what we're seeing now is a new coronavirus, the novel coronavirus. Before you tell someone that you tested positive, make sure that you're talking about the novel coronavirus. If you have tested positive for the novel coronavirus, someone from the local health department would have reached out to you and would have done an investigation and would have identified your close contacts and then would reach out to those contacts. So let's make sure that we're not part of generating rumors and promoting further anxiety. It will take all of us making intense sacrifices to reduce the spread of the virus and free up our healthcare system to care for those who need it most. And now I will translate my comments into Spanish. Nos da tristeza reportar al primero muerte de una persona en Illinois con prueba positivo de COVID-19. Nosotros esperábamos no tener parte con los estados y países que reportaban estas noticias, pero sí lo estábamos anticipando. También queremos compartir una epidemia de COVID-19 en un asilo de ancianos. El primer residente fue confirmado el sábado y 18 tienen pruebas positivas, también 4 de los empleados. Los residentes están en una área separada del asilo o en el hospital, y los trabajadores están en sus casas. Los trabajadores están activamente evaluando residentes para fiebre y síntomas respiratorios, y también midiendo los niveles de oxígeno. Estamos reportando 160 casos confirmados de COVID-19 en 15 condados. Si está enfermo, quédase en casa si tiene síntomas. Si sus síntomas no mejoran o si tiene una condición, llame a su doctor antes de salir de casa. Son sacrificios de todos tenemos que hacer para reducir la transmisión del virus y tener disponible nuestro sistema médico para personas que más lo necesitan.